Good afternoon. I'm Cheryl Mullenhoff. I'm an RN. I volunteer at Crossroads Clinic Volunteers in Medicine. It's a journey I have been really, really happy to do after I retired from my primary work in the hospital. So think about when you go to your own doctor. We function as a primary family clinic, but the people who come to us don't have insurance but they have health needs. So we serve Western St. Charles, Lincoln, Warren counties, adults 18 to 65, and their household income, their gross income needs to be at or below 200% of the poverty level. And then, those are the primary primary pieces of data we need for them. And then I always make sure that whatever their healthcare need is, it's something that we can manage, and I've never had to say no. These are people who have diabetes and hypertension and other things, and for whatever reason have not been able to take their medicine on a regular basis. So they're very happy to come here. The clinic, actually, that idea started with Dr. Mamouna Bey. She is certified in internal medicine. She initially practiced in Warrenton and then at Lake St. Louis. And she began to notice that her people were losing insurance and they were coming to her saying, "Doctor, we're going to have to stop seeing you." Well, she didn't care if they had insurance or not, but she brought that attention to a hospital president, and both of them began the work to create Volunteers in Medicine. We've been in the Lake St. Louis area for almost 15 years. We opened our doors in August of 2010. We now are in 26 January, so we've been open 16 years. And we've moved to this location. We're at 1021 Wentzville Parkway, Wentzville, Missouri, and we've been here since the middle of September. And we're happy to be here. The people we're meeting are glad. There's close service, and just felt really embraced. We have capacity in our schedules to see more patients. Doctor?
Yeah, same thing with me. Dr. Begg was having the same problem. I was having patients lose their job and lose their insurance, or they had part-time jobs that didn't provide any benefits, and that's who we help. Most of our patients have jobs. We have some people who are unemployed, but they have odd jobs, and so they fall in the gaps. And we were already functioning before Obamacare happened. When Obamacare happened, nothing really changed for us. We were still treating the same people. And Dr. Begg and I were discussing, and she asked me for the help, and I've been helping out since 2012. Helping her out and the group, and I just love doing it. I have patients who lose their job, lose their insurance. I see them here. I have people who I see here who get a job with insurance. I see in my clinic, so that you get that patient care continuity that really gives better care. Mm-hmm. We do standard internal medicine, family practice medicine. 80% of our visits are blood pressure, cholesterol, diabetes, taking care of a chronic medical problem. We do the cancer screenings, mammograms. We can help people get colon cancer screening. We do skin cancer screenings, and we're able to get them to get the follow-up they needed, often free of charge.
Let's say that again. Because everybody who is here volunteers their time.
Yeah.
Care here is free.
Yeah.
Free.
And the wonderful physicians I work with in the community have provided, low cost and often free follow-up, including surgeries. We've had people have orthopedic surgeries and all different types of problems covered by all the doctors that in the area. It's the same quality that you get if you had insurance, because it's the same doctors. The hospitals, SSM, BJC, and Mercy hospitals all volunteer and help out. They donate free lab, free radiology, x-rays, CAT scans, even MRIs. They've donated free surgical suites for patients who qualify.
There's one caveat for that. Those hospitals have, just like we do, they have a charity application or a financial application. Mm-hmm. Our patients complete that on the first day they're here. They tell us what's their hospital. We complete that application, we send it in, it gets reviewed. I've never had a patient denied. It just takes time, and then they will send them a letter saying, "We reviewed your information, and going forward, you will have a copay of whatever that is." A lot of times it's very, very low.
We don't charge at all for what we do. The hospitals and specialists have their own arrangements they'll make with the patients, but it is the freest that we can make it. And so, I mean, people with sleep apnea, we've got them tested and got them CPAP machines for their sleep apnea, which helps prevent not only chronic fatigue, but also atrial fibrillation, which is a very dangerous disease. So I think we've done a really good job of filling in the gap for people who don't have insurance. Sadly, with with COVID, Medicare, Medicaid expanded their roles, but they're reversing that. So a lot of people are going to go off Medicaid
And Obamacare.
and Obamacare. So we're here. If you're losing it, contact us. And there's other free clinics in the area. There's a website. You can find free clinics wherever you're at. But we're the one here in Wentzville, Western St. Charles County, helping Lincoln County and Warren County. So we'd be glad to help you and love to see you. Yes.
636-561-3133. And once again, our address is 1021 Wentzville Parkway. We actually sit at the corner of Meyer Road and the Parkway, right across from a Walgreens. Is the clinic.
Yeah,
We're
and also
open,
we
didn't say we're open Tuesdays and Thursdays from 9 to 1. As we get busier, we'll look for more volunteers and extend our hours.
we can definitely take more patients than we are right now. We also need some more volunteers as we get these more patients. We have 6 doctors volunteering currently with us and donating their time for free. We have 7 nurses, including RNs, nurse practitioners, and LPNs, and about 20 other people help out with clinical staff, making the office runs, answering the phones. We have a board of 12 volunteers who in the community are leaders in the community who add their expertise to help us operate and keep us financially sound, and they're doing a great job.
Let me say something too. Our brain is an organ just like our heart and our kidneys, and sometimes it gets sick and doesn't work well. We do have a mental health counselor with over 40 years of experience. Jim is here every Tuesday all day, and we partner with Compass if the individual needs more than we can offer for mental health counseling. So really I feel that we're able to treat the whole body and spirit here.
Wonderful. Awesome. Thank